Good morning and welcome to the kickoff of Primary Care Week. My name is Noraida Negron. I'm the Public Information Manager for the City of Laredo, and I'll be the MC today. We begin this important week dedicated to raising awareness about the vital role that primary care plays in maintaining our health and also our wellness. Throughout the week, we'll be offering a variety of services that promote proactive health management, including free health screenings, behavioral and mental health services, chronic disease management support, and also immunizations. Today's event is just the beginning of our commitment to ensuring that every member of our community has access to the care that they need to live healthier lives. Before we continue with the program, I would like to present our special guests that are joining us with us today. First and foremost, our Mayor of the City of Laredo, the Honorable Dr. Victor D. Treviño. Council Member for District 6, the Honorable Dr. Tyler King. Health Department Director, Dr. Richard Chamberlain. Medical Health Director, Dr. Fernando Sanchez. We also have others representing different healthcare organizations as well with us today. Representing Laredo Chamber and PAD Specialist, Mr. Adrian Zapata. And we also want to thank LMC, also one of our partners, Dr. Mario Flores, for being here with us today. We're here to not only celebrate Primary Week, but also to take part in the comprehensive health fair that we see downstairs provided by the City of Laredo Public Health Department. This event is just a reminder that our health is our greatest asset, and it's never too early or too late, of course, to take steps towards a healthier future. To officially mark the start of Primary Care Week, it is my honor to introduce Mayor Dr. Victor Treviño, who has dedicated himself to health and the well-being of this community. Mayor?
Thank you and good morning, Dr. Victor Treviño, Mayor for the City of Laredo. It is my privilege to be here to speak on National Primary Care Week. And as a family physician for over 40 years, and 36 of those right here in the health department, local primary care physicians have played an important role in our community and have created an incredible partnership with providing care for our medically underserved community, in which these designations are mostly in South Laredo. I would like to take the opportunity to mention some of these primary care physicians who have moved on or passed or retired and no longer with us, like Dr. Esteban Alejo, Dr. Enrique Becerra, Dr. Milton Haber, Dr. Gustavo Real, who will be honored this month, and many more. As primary care providers, some of us have been able to do this for decades with very little resources, and by seeing most double the average of patients that primary care physicians see. But we have not done it alone. There has been an incredible partnership with the Health Department and Gateway, which used to be here next door, next to the Health Department when I first started. These partnerships have also allowed us to focus on prevention and engagement in our underserved populations. So as mayor, I will continue to support the role of primary care physicians in our community, and I want to thank everyone in public health, but because without this partnership, we would not have come this far with primary health with so little. And before I conclude, I want to encourage everyone and remind everyone to vote, because this is how we get more resources. Early voting starts October 21st. Thank you.
Thank you, Mayor. Next, we have a special guest who is not only dedicated to being a public servant in our community, but also a strong advocate for health and wellness in our community as well. Please help me welcome Dr. Tyler King, City Council Member for District 6.
All right. right, thank you, everybody. Is Sister Rosemary here this morning by chance? I just wanted to give her a shout out because this we might not have been doing it this week without her encouragement. Just last year, Sister Rosemary, who I know all of you know, recommended that we start a Who's My PCP campaign and try to encourage more people in Laredo to know who their PCP is, so they're not using emergency rooms for runny noses and wasting resources, and making sure that we're making sure everyone has their primary care physician. And let's be honest, we need about 20 to 21 more primary care physicians than we currently have in the city. And each of those primary care physicians will probably need at least one, eventually, nurse practitioner, physician assistant. You know, as much as we're proud to be physicians, at the end of the day, the only way we're going to be able to serve all the patients that are needed is also in the use of our friends in that space as well. So I do want to appreciate and thank you to the mayor for his decades of service to our city as a primary care physician, and all the people who've come before us. We have Dr. Mario Flores here, who is in the beginning of his journey as well. And you know, it's important to highlight the residency program that's bringing so many new physicians to our program. So you have the Laredo Medical Center, Gateway Community Health Center, Tigmer University Incarnate Ward. There's 4 institutions there creating this family medicine and internal medicine residency program. And right now, as we sit here, we have at least 6 to 7 primary care physicians currently serving Laredoans because of that residency program. If it wasn't for that program, they would probably not be here, most of them not originally being from Laredo. So the whole point of residency programs is to bring new people into the community who would not otherwise have known about the place, because about 60% of people stay where they do their residency training program. So that's why it's so critical that we have these residency programs. So, really excited to be celebrating this week. As Narida mentioned, this is just the beginning, and hopefully we can start working on that campaign where we kind of create these viral moments where people are sharing on social media who their PCP is, and making it more of a norm to have a PCP and not to be using emergency services that are so desperately needed for non-emergency reasons. So thanks for being here, everybody. Thank you, Dr. Chamberlain, for putting this on. Thank you to all the City of Laredo public health staff for all that you do every day. Let's just try to encourage more of our, when you have a family member, when you have a friend and you know they're going to the ER, encourage them to find their PCP after that if they don't have one. So that's what we're trying to do, and thank you for being here. Yeah. Okay.
Thank you, Dr. King. I also wanted to recognize other partners that are also with us, that are here with us this morning. Sonia Lara from Doctors Hospital, thank you so much for being here. And also Karina Garza from Laredo Physicians Group, thank you also for being here with us. As Medical Health Director, he plays a crucial role in guiding public health initiatives and ensuring that comprehensive care is accessible to everyone. Please help me welcome Dr. Fernando Sanchez, our Medical Health Director.
Good morning. Well, my name is Dr. Fernando Sanchez. I am an infectious disease and an internal medicine, and also the medical director for the City of Laredo Clinics. Good morning. Thank you all for being here. Primary Care Week is where we as physicians have an opportunity to display new approaches to healthcare, celebrate progress, network with colleagues, and explore new approaches for underserved population. Laredo is an area where we're blessed to have the strategies, support, and healthcare providers that continuously work to accomplish these goals. Laredo, being an underserved community, struggle as any community will, but we strive to provide the best care to our patients. This week is a reflection or an opportunity to highlight the efforts that the health department, our city, our primary care providers do on a day-to-day basis. As a physician, I can say that we truly love what we do. We do it to share our skills in a way that can help and strengthen our community. We want to ensure that we provide preventative care in addition to chronic care. This commitment is made with an oath that is thought of daily. We thank you for acknowledging Primary Care Week. Thank you.
Thank you, Dr. Sanchez. Next, I would like to introduce someone whose leadership within the Laredo Public Health Department has been instrumental in making events like this possible and so much more. He and his team have worked very hard to ensure that today's health fair offers a wide range of services, and not just this health fair, he does it all year round. Please help me welcome Laredo Health Department Director, Dr. Richard Chamberlain.
Whoopsies. Good morning, everyone. It's great to see everybody here today. As we recognize National Primary Care Week, we're reminded of the pivotal role that primary care plays in fostering a healthier community here in Laredo and beyond. This week serves as an opportunity to highlight the importance of primary care as the foundation of our healthcare system and reflect on how our local efforts contribute to national public health goals. At Laredo Public Health, our primary care program is dedicated to providing accessible, high-quality healthcare services to all residents, with a focus on preventative care, chronic disease management, and health equity. Primary care is essential for addressing health disparities, especially in underserved areas like ours, where social determinants of health, such as income, education, and access to care, can greatly influence health outcomes. Primary care is the first line of defense against illness. It enables early detection of health issues, promotes healthier lifestyles, and reduces the needs for costly interventions later on. By investing in primary care, we can improve the overall health of our community, reduce hospitalizations, and alleviate the burden on emergency services, as mentioned a few short moments ago by Dr. King. For Laredo, we operate in a binational context with unique cross-border health challenges. Primary care also means addressing communicable diseases, environmental health risks, and access issues that are specific to our region. Our program aims to not only be a provider, but an advocate for public health, working in partnership with other health systems, schools, community organizations to ensure a comprehensive, culturally competent care for everyone. During National Primary Week, let us reaffirm our commitment to strengthening our primary care systems and ensuring that Laredo residents have the opportunity to lead healthier lives. Together, we can build a healthier, more resilient community through primary care services that prioritize prevention, accessibility, and equity. Thank you so much to the Mayor, Dr. King, and to the doctors that are here present with us, but most importantly, thank you to Laredo Public Health staff for everything that you do day in and day out as you are committed to public health excellence. Thank you.
It is very clear that efforts of both the City of Laredo and also Public Health Department are making a significant impact in our community, and it will continue. Now let's get this health fair underway and the entire week, so please take full advantage of all the many services available today. I would ask, of course, our mayor, council, health, and everyone else that are here to maybe do a group picture right now. Thank you. Oh, that's right. We need to do the proclamation. Sorry, Mayor, come up. Let's do that first, and then we'll do the picture. Yes, very important.
Office of the Mayor, City of Laredo, Texas Proclamation. Whereas, primary care is the foundation of a healthcare system, providing comprehensive, accessible, and coordinated care that is patient-centered and focused on prevention, wellness, and early intervention. Whereas, primary care professionals serve on the front lines of health care delivery, working tirelessly to improve the health and well-being of individuals and communities. And whereas, primary care reduces overall healthcare costs by preventing the onset of illness, managing chronic conditions, and minimizing the need for emergency and hospital care. Whereas, National Primary Care Week is an opportunity to recognize the critical role that primary care plays in health in our nation and to highlight the importance of training and supporting the next generation of primary care providers. Whereas, during National Primary Care Week, medical schools, healthcare institutions, and community organizations come together to emphasize the value of primary care in achieving better health outcomes, reducing disparities, and enhancing the quality of life for all people. Whereas, this week serves as a call to action to invest in primary care infrastructure, expand access to primary care services, and address the challenges that primary care professionals face, including workforce shortages and healthcare inequities. And now, therefore, I, Dr. Victor D. Trevino, by the virtue of the authority vested in me as mayor of the city of Laredo, county of Webb, state of Texas, do hereby proclaim the week of October the 8th as National Primary Care Week in Laredo, Texas, and I urge all citizens to join in recognizing the essential contributions of primary care professionals and to commit to advancing the principles of equitable, accessible, and high-quality health care for all. Thank you. Now we'll take a picture.
Yeah. Do y'all want to jump in for a photo?